And we know this is a lot that's unclear surrounding future access to abortion care. And as we await that implementation of that 24-hour waiting period, we want to know what this change means for women here in Iowa. Now, Local 5's Larissa Leone spoke with a doctor who shares how these changes have created confusion in the medical industry. Larissa.
Samantha, there is a lot of confusion, as you mentioned, on what effect changes to abortion legislation has on women's health. One doctor I spoke with says she feels like her hands are tied, and helping her female patients make impactful decisions on their body is getting harder and harder to do as opportunities dwindle.
Lina Maria Murillo is the assistant professor of gender and women's studies at the University of Iowa. She says the changes to abortion laws affect socioeconomic classes differently.
These kinds of laws exacerbate poverty in the state. And so that's what the 24-hour ban really does, right? It really is punishing poor folks further for trying to have some sort of control over their reproductive lives.
Murillo says within that 24-hour waiting period, low-income mothers who want an abortion may now have extra worries and extra costs.
Folks who may have precarious work conditions, right? And they can't always take consecutive days off. Folks who might have childcare, other kinds of care concerns may not have the extra time. And so this becomes really a financial burden.
Dr. Payal Kohli is Local 5's medical expert. She says because of the amount of changes to abortion laws, she's having trouble knowing how to best care for her patients.
There's also a lot of confusion. Confusion amongst physicians now about what's legal, what isn't legal, what can I advise my female patients to do with their pregnancy.
Dr. Kohli says she feels like those gray areas are restricting the care she can provide for her patients.
It's tied my hands to be able to talk to my patient who might be a woman that's pregnant and talk to her about all the potential options. So as a physician, my treatment options are immensely limited.
Many of you may still have some unanswered questions, and the experts I spoke with say that's normal, as there's still a lot of aspects that are unclear. Stay up to date with us here on air and online at weareiowa.com for all updates on abortion access in Iowa. Larissa Leone, Local 5 News, We Are Iowa.